Over $214 billion, Ontario's biggest spending budget ever, is now out, and it includes investments in a number of areas, but also a higher deficit than previously projected. Finance Minister Peter Falvey is acknowledging the challenging economic times we're in, saying life has rarely been this expensive, but the budget also contains very few new affordability measures. Falvey says he has made a choice to increase the deficit rather than cutting spending or raising taxes or fees for Ontarians. The fiscal blueprint projects a deficit of $9.8 billion, nearly double what was projected last fall. This will lower to $4.6 billion next year, with a $500 million surplus projected in 2026, just in time for the next election.
So with all of that in mind, we're joined live in studio this morning by Liberal leader Bonnie Crombie to talk more about the provincial budget that was delivered yesterday, the biggest spending budget in Ontario history here. But you don't think the spending is necessarily enough, particularly when it comes to healthcare and education?
Never has a government spent so much and done so little, quite frankly. $214 billion with a growing debt and a growing deficit. It's unambitious. It's a do-nothing budget. It does not target what Ontarians need from an affordability standpoint. People are struggling today, struggling to find a doctor. There are over 2.2 million people looking for primary care and a doctor. They're struggling to put their children into daycare, and they're struggling with exorbitant rents and mortgages. And it does nothing to address the key issues with respect to our public education system, the shortage of teachers, of special education workers and their assistants, as well as nurses. Nurses are leaving the system. The system is bleeding. For every 10 nurses recruited, 6 leave the system because they are not paid a fair wage.
Okay, so Finance Minister Peter Falvey is going to join us in about half an hour's time and is going to say exactly the opposite of what you're saying, pointing to paying for, healthcare teams, pointing for recruitment of healthcare workers, et cetera, and also pointing to an increase in education of 2.7%, which some people are saying is below inflation. So how do people sort of sort through this then? Because you're hearing two completely different narratives of the same document.
Well, ask yourself, what have they done to make it easier for you to access primary care? In fact, we've seen the billboards where you can sign up at a private clinic. You can use your credit card rather than your OHIP card to access medicine. That's not the direction we want Ontario to go. Look at our classrooms and the teaching shortages, the lack of special education teachers and their assistants. Our children are not receiving the assistance they need in the classrooms. Teachers are leaving the system. Nurses are leaving the system. And hospitals, which are underfunded already, have been not giving any additional funding. In fact, it's an effective cut what our education system is receiving. They are relying on agencies to bring in nurses, and they're paying them double what their own nurses are being paid.
Yeah, we saw something like $1 billion in agencies' use in the last year or so. So I have to ask you then, we're still a couple of years out from an election, but if a Bonnie Crombie government, a Liberal government, is elected in 2026, Peter Falvey made great pains to say, we're not going to raise taxes, we're not going to raise fees on Ontarians. Are you saying that that's what you would do, is raise taxes and raise fees to meet the needs of what you're suggesting we're missing?
Honestly, it's a question of priorities. Where has the spending been going? Bill 124 was a disaster for this government. They spend money that they otherwise should have been investing. To our healthcare heroes, our nurses and our teachers, our educators, the money needs to be put in healthcare so everyone has equal access to healthcare. It needs to be put into education. So what we've seen is classrooms that are too large and teachers who are leaving the profession. We need to pay them properly. We need special education teachers. We need special ed assistants in the classrooms for our children. That's the difference. That's what we would do. We would double ODSP as well, and we would invest in autism assessment and treatment. That is so important. I hear from families with autistic children all the time that they aren't getting the services that they need.
So then how would you reach those spending priorities? I'll kind of go back to the original question.
Yeah.
Would you raise taxes or fees? Because, this is a $214 billion document, $85 billion just to healthcare alone. How would you meet what you're talking about then?
So look at the cuts that have been made already, whether it's the license plates or the freeze in the gas tax. This is money that otherwise would have been in the system. The freezing of the gas tax, for instance,
so you'd bring
may
it back?
have saved $3 billion. And that could have been invested in our hospitals. Well, I ask you, let's ask people, would they prefer that money going into their hospitals so they have access to health care, doctors and nurses when they need them? It's a question of priorities and where you allocate funding, but any cut they make is money that otherwise could have been used for access to health care, nurses or invest in our public education system to strengthen it.
So I hear what you're saying about those, but the issue that many people are talking about, and I'm not talking politically, I'm just talking about at the grassroots level, and I'm sure you've heard this speaking to so many Ontarians, is just the cost of living affordability situation that we're dealing with here. We hear from the government, they're saying, hey, if we cut fees, cut these gas taxes, et cetera, that's making it more affordable. Are you saying there's a cost to those cuts then?
Well, yeah, of course there's a cost to those cuts, but it's also tinkering around the edges. You know, I ask you, is your life more affordable today before Doug Ford became Premier 6 years ago? And I know the answer to that is no. Our young people are losing the dream of owning their own home ever. They can't even find a rental that they can afford. Price of groceries is staggering. People are having to choose if they should buy meat this week or pay their cell phone bills. I mean, the affordability level has reached a crisis situation, and this budget, in fact, is a disaster for families.
Okay, well, we will, of course, have Minister Peter Bethlenfalvy to talk about this coming up in about 20 minutes' time. In the meantime, Liberal leader Bonnie Crombie, thanks for coming in and sharing your thoughts this morning. Good to talk to you.
Thanks for having me.